Hi, it's Dr. William. I'm doing some fat grafting to the breast, and I just want to take a moment and show you the different types of fat that are used in plastic surgery and then specifically for the breast. Here I've got 3 different types of fat. This is what we call a macro fat. So this has kind of been processed, but it hasn't been passed through any of the little devices that make it smaller. So that is macro fat, and it's bigger globules, and this is what I use for a BBL. This one is micro fat. So these are smaller pieces that are coming out here. And then this is nano. Look at how fluid this nano is. This is not going to really give you any volume, but this is a different style of fat. This has regenerative properties. So that fat cells have actually been broken down and emulsified, and they are rich in growth factors and stem cells. And so it's fantastic for helping the fat survive, and it's also very good for the quality of the skin and the tissue. So I'll use the nano fat for those properties, but it's not providing us the structure, the volume. When I want volume, then what I use is the micro fat. And so that's here. Look at the difference. Nano fat is very, very soft. It's very fluidy. This is different. This has more structure to it. There's more cells in here. But it's not as beefy and as heavy as this one. And so when we're doing more large volume, we're going to use the macro fat. That's where the BBL comes in. But when I do breast, I use these two. I use micro to get me the volume, and I use nano to help get the tissue better and also help with the micro fat survival. This is a case where the patient had very large implants. I'll show you here before. The implants became a burden and they were just too big for her. She wanted the implants to be removed. It always gets a little tricky because the question is, once you remove the implant, is there enough volume left to be able to do a lift and organize the breast to get a good shape? And in her scenario, it was true mostly. That is, her left breast is quite a bit bigger than her right breast. Now, I don't have an implant to work with because I've removed the implant. She doesn't want them anymore. How am I going to get these breasts to be more symmetrical without using an implant? The answer is fat. This is the pattern for the lift, and I know it doesn't look particularly attractive at this stage, probably you're thinking, but here's the main substance of her breast, and she's lacking some volume in the upper part of her chest, cleavage area, and some overall fullness. Hey, if you have a question or comment and this video is not making sense, don't worry, just leave it in the bottom and I'll get to it next week when I'll answer questions about this video when we're doing another video. Enjoy. So I'm going to make tiny little incisions. You can see them here. There's a little incision there I just made, and that's why this is bleeding. And there's a little incision there. And I'll use those tiny little incisions and I'm going to inject fat, and you always have to inject it in sort of this 3-way pattern so that you get really good take of the fat. After I've got the structural microfat put in, we've got the shape and the volume and the symmetry and the cleavage, then I'm going to put a little bit of the nano fat, and that one I just layer on top, and that has all those really good factors that are going to help her skin, and it's going to help this fat survive as well. Let me start with the micro. Now we got a little cannula in here. And then what I'm doing is I'm just threading that fat. So it's coming out as I'm pushing in. So I'm right in the breast tissue here and in the fat. And that's really where you have to be, because the fat has to be put in that area in order to survive. And you can't put, like, she had 500cc implant. If she wanted to remove her implant and just use fat, she couldn't do that in one setting, because you can never put 500 cc's of fat in here. The reason I'm not using the whole aliquot of fat here is because there's always a little bit of oil at the end, and I don't want to give the oil because that's not going to help us in any way. You don't want to overdo it. You overdo it and you'll get more fat loss, so I don't want that. Now I'm going to use this beautiful nano fat, and I love this stuff because it really makes a difference. I'm putting nano throughout the whole breast. Use the benefits of the fat throughout the whole breast, not just where we want the structural. So I'm not trying to go and recreate all of her volume by putting fat in the same amount that she had the implant. That would defeat the purpose. So I put about 100 cc's of fat in here. So I've taken 500 out, so she's gone down by 400 in essence, which is still a huge change in her size, and I think she'll be happy with that. But it's also allowed us to get a better shape to her breast and to get better symmetry. So fat grafting to the breast, something I use frequently. It's super powerful, it's fantastic. And you can use it with really any type of breast surgery, not just implant removal, but I use it also with augmentation, with a lot of my revisions. Fat is just a really nice adjunct to what we're able to do. All right, I'm gonna get to work on the other side. Okay, Veronica, so when do you need a vertical line in addition to the traditional horizontal line for a tummy tuck? So in a typical tummy tuck, patients will have excess skin that's in this direction. So they end up developing extra skin along here in the lower abdomen, and then you end up with a cut here, and we remove all this skin, and you end up just with a final scar that's down low in your abdomen. Because most of the extra skin is coming down this way, so we make the incision this way. So when we have extra skin in this direction, which most people do, then most people will get a traditional tummy tuck, which is a single horizontal scar. If you also have, and this is most common in patients that lost a lot of weight, if you also have the traditional excess skin in this direction, then we still will do the tummy tuck through the traditional scar here. But if you've lost a lot of weight, these are usually patients that are around 100-pound weight loss, then they may also develop extra skin in the horizontal direction. So here, the extra skin is in this direction, and we make the incision this way. But if you have extra skin this way, then you have to make the incision this way. So we're always making our incisions perpendicular to the excess skin. So in this patient, if they have excess skin here and they just do a tummy tuck, then when they lean over, they're gonna have more skin that they can grab in the middle and it can bother them. And so the way we get rid of that skin that's in the horizontal is we make an incision in the other direction, in the vertical direction. This is called the fleur-de-lis pattern. It's not used often. We try not to use it. In the old days, we used to use it quite often because patients would have had a weight loss surgery with a big scar down the middle, so we could just go and remove that scar and then do our scar and remove that skin. But today, patients are either losing weight on their own or with one of the injectable medications or with a bariatric surgery, but the bariatric surgery is just done with little incisions, usually like 6 of them, to do that. So we don't have this scar that we can use. So in the old days, it was not a problem. Patients had a scar, you'd say, well, I'm gonna have to put a scar here and put a scar here. And they're like, fine, I already got a scar here. We're like, we'll make it look better. But that's the main differentiator right here. If you have vertical excess skin, then you're gonna have a horizontal scar. If you have horizontal excess skin, that says horizontal, then you're gonna also have a vertical scar. So that's the reason. This is not as common to have a fleur-de-lis. It's typically done in patients that have had massive weight loss, usually 100 pounds or more.